So now let's move on to what's new in the medicine chest, part 2. We start with oral apremilast, which we know is an oral phosphodiesterase 4 inhibitor that is approved for the treatment of plaque psoriasis in patients that would be considered for systemic therapy, where topical therapies have not adequately controlled those patients. There's new information, first of all, and a new indication for Behçet's disease, where patients may be coming to your office with oral ulcers that are painful, that you may be thinking they're apathy or herpes simplex. Every once in a while, though not common, you may be seeing a patient with Behçet syndrome, so you need to have an index of suspicion. Also, if we look at some of the monoclonal antibodies, we have dupilumab, which interferes with IL-4 and IL-13 for the treatment of atopic dermatitis, approved for moderate to severe disease in patients that also have not been adequately controlled by topical treatment. We have a lot of efficacy and safety data on that drug, but keep in mind, there's information now that some of the variant presentations of atopic dermatitis, like prurigo nodularis, respond very favorably in that group of patients with atopic dermatitis, very pruritic disease, and do very well with that drug. There are also 2 new drugs on the horizon that are monoclonal antibodies that actually bind to IL-13, lebrikizumab and tralokinumab. They both have been under study. Lebrikizumab has very good data against pruritus and improving atopic dermatitis, and potentially may have an option to go every 4 weeks with the subcutaneous injection rather than every 2 weeks. And both lebrikizumab and tralokinumab appear so far to show a lower incidence in conjunctivitis than we've been seeing thus far in the select group of patients with dupilumab. The Janus kinase inhibitors, there's a lot of information on those. Too much to talk about in this small little discussion here, but there are several that are being evaluated topically and orally for the treatment of atopic dermatitis. These include arbocitinib, baricitinib, and others.